Imagine having to pass an interview with your surgery's receptionist first to see if you really do need that appointment. Well, that's what's happening in one health centre near Oxford, where a shortage of doctors and a growing elderly population has left them struggling to cope with the demand for appointments. But do you think you'd really want to give the sort of intimate details as to why you want to see the doctor? Would you want to tell the receptionist?
Well, no, I don't think I would, actually. I wouldn't want to have to give... yeah, because sometimes it takes a bit of courage to get in there and start a conversation, doesn't it? And then say, what's the problem? But I think where this would be most dangerous, actually, is for people that might be depressed and not really know, but they might go in for something else. Or if you're a man... I mean, we know that men are just the worst for going to see the doctor about anything. I mean, when I think back to when Mark had his... because he's a proper hypochondriac, you know, and the last time we had months of him in tears and God knows worrying about it was that he had prostate cancer. And I was saying, listen, if you think you've got, just go to the doctor and then you don't have to be worried anymore. Oh, but it'll be so embarrassing, because you know what they have to do when you think you've got that. And the thought that he would have to say that first to a receptionist, he definitely wouldn't have gone. If he'd had to explain it first, he wouldn't have gone. And, of course, he was fine in the end, you know, he was just a worrier. And, so
I mean, if it's an ingrown toenail, OK, you're not going to be bothered. But, I mean, I suppose there is sometimes a relationship with your doctor. I don't know whether I'm being romantic about this. It's almost a confessional, isn't it? Yeah. That you can go into their room in the surgery and you feel absolutely that this is confidential and it's these four walls. And, as you say, when it's a really difficult topic. I mean, thankfully for me, it's mainly ingrown toenails or stuff like that. But there was one occasion that I was really anxious. You know, I was having a bad period in my life, and actually, I did go for something very innocuous, which I think was a cover. Yeah. But, you know, I thought, I'll just go to the doctor, and I said something just trivial. And actually, I was speaking to this doctor, and I totally surprised myself. I just burst into tears. I was just bawling like a baby with this doctor. But because I didn't have a relationship with him, and it is a kind of whatever doctor you get, and he is a bit of an uptight guy, he just sat and looked at me, and you could see him thinking, not how do I get her out of here, because that would be unfair, but he did not know how to respond to me. And I was embarrassed, because I thought, I'm embarrassing this man, and I was trying to pull myself together to stop embarrassing the doctor, and it was as soon as we could both get out of that room that we did. Whereas if I did have a better relationship, it might have got somewhere. And also, there's no way that I would have been telling a receptionist. I just feel rubbish.
I think as well, you know, I agree with you completely that you are embarrassed, obviously, to talk to the receptionist about it. But if it's something that is potentially serious, you know, like you're talking about Mark's thing, I know when, you know, I've talked on this programme before about having postnatal depression after Amy. It took me years, literally years, to pluck up the courage to actually say it out loud, not only to myself, but, you know, to the GP. But I had built up a really nice relationship with... It was a female doctor, so that by the time I had said it out, my biggest fear was that they'd go, oh, pull yourself together, don't be so ridiculous. Because if they'd have done that, I'd have clammed up and never mentioned it again. But the fact that I had built up a relationship meant that she was empathetic and supportive and what have you. And interestingly, you know, you're saying about you'd gone in about something else, but you think subconsciously it was a cover. A friend of mine's a GP, and she said, interestingly, a lot of people will come in with ingrown toenail, whatever. And it's literally, as they're getting up and going to the doctor, they go, oh, by the way, I found this lump. And that's actually what they've come in for, but they're almost too embarrassed to say it.
The other side of it is doctors are under pressure, and a lot of people do go to the doctors with trivial complaints, take up time.
Oh, my God, she goes to the doctors regularly. She went about 200 times one year, and then the doctors had to say to her, look, you're not allowed to come in all the time. You're allowed to bring us once a month, and if we think you need to come in, then you can come in.
What sort of things was she going in for?
Oh, she'd go in for one thing, then she'd say she's got cracked heels, or she's got some cream for cracked heels, or she'd have a list of things. You've never seen anything like her medicine cabinet, honestly. She's probably watching this, she's going to kill me, but she knows exactly who she is. But they are time wasters a lot of the time. They use up the time. And I've got a really good receptionist at our doctor's surgery. We've known them for years, and they know that if I ring up, it's something serious, or it might be Lila or whatever. And I don't mind telling them what it is, because then it cuts out, and then the doctor will ring us back afterwards. Because I've been there a long time, and I've got a really good relationship with one doctor in particular there that's been there for a long time. But so that does save the time wasting. If you tell them what it is, then the doctor will ring you back and say, well, you need to come in, or you need to bring Lila in, or whatever.
Which is important, because I mean, when I think of Nanny Thelma, you know, she's 94 now, and, you know, she's got breast cancer, she's got diabetes, she's got a pacemaker. She's 94, she lives on her own, you know, she's an amazing, amazing woman. But, you know, quite often we'll go and see her and she'll have something like... I remember a few months ago, she had this really bad pain come into her hands and I said, Thelma, you've got to go to the doctor. She said, oh, there's no point. She says, there's no point me even phoning. There's no point, Nadia, because I won't get an appointment. And I think,
that's really sad.
Come on. I mean, I think there should be, you know, if you live to that age and you can't get a doctor's appointment, living on your own with all of those things, right, she just doesn't bother.
And do you think she really can't, or she's just trying to sort of...
Not waste anybody's
bother the
time.
doctor? Because,
yeah.
I mean,
well,
a lot of the time...
she says whenever she rings up, she can't get an appointment for a couple of months, and I say to her, ring up and, you know, be stronger. Say, you know, be more forceful.
Yeah,
say that you've got to have it. And then I think she goes into... the old, you know, the old war spirit. Oh, no, I'll manage.
But that's a terrible thing, Nadia, is obviously... this is where I really feel sorry for receptionists and doctors as well, is you're finding that balance between someone who'll go in because they've got cracked heels and an old lady sitting at home who's too scared to try and make an appointment. It's trying to find that balance of getting the right patients through the door.